Yes.
All right. Well, thank you so much, Ali and Ashley, for having me as a guest speaker today. I'm so honored. And I just love and care for all of you so much that I know on this meeting. And it's just so near and dear to my heart to be a part of this group and be able to share something. And it was hard to think of a topic because I want to speak to you guys about everything. And I'm so passionate about everything around all your individual cases and things that you've been through and struggled with. And I was speaking with Allie recently, and the things that she just organically shares with me. And I just know that you all, like everybody here, would just love to hear and share and all these things. So, anyways, I hope this topic is interesting. I know there's two experts here that have joined us. So I'm hoping that later that they would love to provide further insight and guidance and um, different treatment approaches and things. But my objective really was just to spread the awareness. Um, I'm going to skip this slide for now. I think most of you know me on here, and know that I personally have had some various concussions and things with my brain. So been through rehab and vision therapy, but I want to touch more on just the objectives, but my major objective is to just spread awareness over a topic related to vision and the upper cervical spine. And so I hope to just shed some light on that area of the body and how much it communicates to the brain and to the vision. And so I wanted us to take away from this a better understanding about sensory mismatch and how it's so crucial that your eyes, your inner ear, your spinal cord, your brain all integrate together for function, to do things the way that all these parts of the bodies should be doing, and how interferences in one of those areas can cause such an interruption in that line of communication. So I really want to try to hone in on that piece, and then definitely address the vestibular aspects of vision and upper spinal injuries. So hopefully we can dive into that and just get into the nitty gritty about how symptoms of vision arise and are related to upper cervical issues. So that being said, this is a pretty modified list, actually, that is out there in the research, that a lot of these symptoms are out there in the research, that yes, these visual symptoms relate to issues of the spine and most particularly the upper cervical injuries. But I also gathered some of these symptoms just over the years from patients that have had these injuries and have reported some of these exact things. So, the first one I listed was dizzy, motion sickness, sometimes daily. And then a lot of patients with upper cervical issues have reported looking at fans is torture. And others have reported driving, other cars moving on the side, torture. Others have reported scrolling on a screen, torture, or movies where the screen is moving a lot or the characters are moving a lot, torture. So I find all of those quite interesting with how those symptoms particular to movement relate to the vision and to that mismatch that we're going to talk about between the proprioceptive system, which is fed into the upper cervical, and then the vision and the inner ear, and how if one of those is off, then your brain does struggle to process motion. And then when you dive even deeper into the visual system, as many of you have learned and know that if you're talking about just the visual system, when there's an offset between your central vision and your peripheral vision integrating in the brain, then that can also cause those feelings of torture with looking at a fan, the car movement, scrolling on a computer. I've also had patients talk about terrible pain on the eyes, around the eyes, even connections between the eye, going back to the head, occipital lobe head pain, and then of course like neck pain, right? So all of that contributes to the overall symptoms that they're suffering from. Um, yes, I've had other patients say that third one, that like just being on a screen is just so hard on their eyes. Like their eyes just feel like they want to pop out. And again, a lot of that is just those connections. And I have a good visual in a little bit, but those connections of the nerves that are going between the eyes, and then the eyes through the brain, and then to the spinal connections as well. And then of course, as you guys could understand, like having these sort of symptoms can affect other things, frustration at work, and can impact, your performance on many things. Vision can feel very disoriented when you have an upper cervical issue. Just barely moving the head at times can trigger symptoms, or some of what we'll get into is looking down, down at a phone or down at a computer screen. If there's any kind of compression in the upper cervical region, what that does is it can kind of shut off that jugular vein. So we'll talk more about that. But if you shut off that jugular vein, then you're just building up pressure, and pressure that can even rise up to the eyes. And so we can even see that when we look into the retina, we can see optic nerves that are swollen. We can see high pressure in the eye. We have measurements to show that. And then certainly that can impact even the pressure in the head, and the cerebral spinal fluids, and the fluid in the actual brain. So it's significant. Colors, I'll touch on that. Like some patients with upper cervical injuries will say that certain colors they can't look at, that it causes pain or triggers pain. Some of that connection is to the optic nerve as well on the retina. That's been impacted by all of this. Some talk about depth perception being impacted, which has to do with the eye muscle teaming. They talk about blurry vision, which I'll show you guys exactly on the upper spinal cord where clarity of vision comes into play. So we'll talk about that. Headaches and light sensitivity. Light sensitivity, we will talk about too when we talk about the blurry vision. I think we already talked about pressure and pain on the eyes. So these are just some of the visual diagnoses that we diagnose that are connected and highly correlated to upper cervical injuries. These are really just broad terms, but then within all these areas, we have specific diagnoses that are real common. So like with eye teaming, eye focusing, eye tracking, visual processing, of course, visual vestibular, and just visual integration as a whole. Okay, so this gets into a little bit of the anatomy and structure. So I specifically was showing the C1, the C2, and the C3 here, because the C1 especially I wanted to talk about, because look how close it is to our skull, okay? And so that little vertebrae does so much for us. It holds so much weight of the brain and the skull. And then you can think about just like your center of balance, your center of gravity. So if there's any kind of compression injury here, extra fluid, any kind of severed nerve, you could see like how crucially that can affect things. And then this is just the skull, but if you imagine the brain in there, like this is your occipital lobe over here. So there's such a high connection with these upper cervical vertebrae to the occipital lobe where vision is highly processed. Now, most of you guys know that vision is processed in every single lobe of the brain. And so a lot of injury here in the upper cervical is going to, connect through up to the eye, even up to the cerebellum where that balance and vestibular system is controlled. But what I also wanted to mention, and there are this, we're not going to get into it here, but there are several different types of tests that you can run to, see what's going on in this upper cervical area. But some of them are not showing the level of injury that's impacting the brain so much. And so sometimes even on a standard MRI or MRA or CT, it's not showing. Even on some ultrasounds, it's not showing. So there are specialized providers and specialized imaging tests and things that that can show it, but a lot of times not. And so sometimes it really is just little nerves that got kind of sloughed away or severed or moved or extra fluid like we were talking about. So it's quite interesting. But the jugular nerve also lays in here by C2. And so that jugular nerve, like I was discussing, that's one that can, if it kind of gets in the wrong place here, can impact a lot of that pressure that's being sent up to the brain and to the eye. But also what I wanted to note is that an injury on the C1, it can be fatal or it can cause really, really horrible damage to other parts of the body, in some cases full paralysis. So it's just a really, really special little area right there that I wanted to highlight. There is research on upper cervical injuries, specifically on some C1 injuries as well with vision. And so a lot of it has to do with eye movements, smooth pursuit movements. So I know some of you can relate to that. Like if you're, following a moving target, there's like this little area where that eyes just feel like they can't get over, or they can't move smoothly, or it hurts, or it's painful. And so those are some connections that we work on in vision rehab, where we can help to smooth out those ranges and work on that coordination. But that's something that is definitely out there in the research. Other things that's out there is just anything that has to do with like a little bit of change of neck posture and things that will induce the visual vestibular system. So that there's a lot of that out there as well. Intensifying visual symptoms with little bits of turns of the neck and things. So if anybody wants more of this research, I'm happy to send it out. But yeah, so why visual disturbances when we're talking about the upper cervical? And so this is kind of some nice diagrams here where it gives you even a more zoomed in view of some of these nerve interactions and some of the muscle structures and the alignment of the upper cervical. But a few of them that I wanted to touch on is the superior cervical sympathetic ganglion. So that is over by C2. And if that has been pushed or disturbed or, severed or moved or anything like that, what it does is it has a connection to the eye to control dilation of the eye. And so when that's been impacted, it can make your eye stay dilated. And so that can cause a lot of that light sensitivity because I think all of us can relate to that, if you've gone to the eye doctor and they dilate your eye and then everything is just so bright and it hurts, it's painful to look at the sun, like that's what can happen from these injuries where that's kind of like the norm, where those muscles are just holding the eye in dilation. So that can also cause blurry vision because the sphincter around the color part of the eye that controls some of that focusing has to dial in and constrict down for clarity of vision. So that was a pretty interesting finding. And then there's connections in here that have to do with like color perception of the eye, flickering of vision of the eye. Those are around cranial nerve 2 connections, vagus nerve and cranial nerve 3 connections. That's what we talked about, like with eye movement and different vestibular ocular reflexes that connect in here. So I'm going to just kind of wrap up a little bit so we have time to talk. But there are, as far as vision goes, there's definite treatments for this. So visual therapy being number one to address the visual symptoms, and then phototherapy, which a lot of you are aware of, and then tents, prisms, glasses, things like that can help. But I'm going to go ahead and pause. And then if we want to cut the recording and open it up to others who are much better experts on this than I would